Hi, hello, good evening, everyone. Welcome to another Ask Me Anything session by iMumz. And firstly, I wish you all a very happy Raksha Bandhan today. Hope you all are celebrating well. Today, we have a very senior and a very special guest with us. We have Dr. Kavita ji with us. Kavita ji belongs to the state of Punjab. She's currently practicing in Ludhiana. And she's a very popular gynecologist and obstetrician. And she has clients all across Punjab, and she is currently the head of the department in Obstetrics and Gynaecology department of the prestigious CMC Ludhiana in Punjab. So we are very lucky to have you today with us, Dr. Kavita ji. Welcome to iMumz Ask Me Anything session.
Thank you, Mr. Ravi, and for the kind introduction also. And thank you for giving me this opportunity to be on iMumz and to connect with so many patients, pregnant ladies all across India.
Yeah.
So, and firstly, I want to wish everybody a happy Raksha Bandhan. And I can see Ravi is already wearing 4-5 of them. I think he has many sisters who has tied Rakhi to Mr. Ravi. And also, I would like to tell you that we are celebrating Breastfeeding Week. This is World Breastfeeding Week, which starts from 1st of August to 7th August. And this is celebrated all over India. So in this, we promote breastfeeding. So all pregnant ladies and those who have delivered, who are desirous of pregnancy also, we tell them what is the importance of breastfeeding and what are the advantages to the mother and to the child, how the baby needs to be fed on the breast milk, how long it should be, and how frequently. So, to start with, I will talk to you about breastfeeding. So, as we know, we are celebrating Breastfeeding Week, and the whole week we promote breastfeeding practice and we tell about all the advantages which is to the mother and child. So, to start with, the golden rules of breastfeeding are that one needs to uh, breastfeed the child within 1 hour of delivery, whether it is a normal delivery. Mostly after cesarean section, the mother may have some problems feeding the child because she receives some anesthesia and she may be little drowsy. After the anesthesia, she may be having pain, but it is always best to start the child on breastfeed as soon as possible to make skin contact between mother and child and start breastfeeding within 1 hour or as soon as possible after delivery. Now, breastfeed should be given exclusively for the first 6 months. So, you need not give any water, you need not give any honey, because there is a practice of giving honey, but that usually we tell them to avoid and not to give anything except breastfeeding for the first 6 months of the baby's age. After 6 months, you can start the baby on complementary feeds. Like you can start them on other things like banana and mashed potato, dal, and whatever is available for the infant. And during that time, you can start. And the breastfeeding, they say, should continue till at least 2 years of age and beyond also if required. So it is very important to start breastfeeding as soon as possible. Continue it for 6 months exclusively. Exclusively means only breastfeeds. And then you can continue with complementary feeds up to 2 years of age. So while breastfeeding, why is it important for the mother and for the child? So, breastfeeding is the best possible start that you can give to a child. Now, what are the advantages to the child? It increases the survival rate in the child. The health is maintained, and there are a lot of nutritional and emotional benefits that are involved to the child. So it is available natural. So you need not even boil it or think about sterility. It is easily digestible and it is all the nutritional contents that are needed for the child. And remember, the first few days when only small amount of breast milk is coming, like a what we call as colostrum. So it comes as a yellowish small amount of breast milk, that is known as colostrum, and that contains the most nutritious milk that is supposed to be given to the child. It has all the antibodies, all the nutrients, and it is actually sufficient for the baby for the first few days. So giving that colostrum or the yellowish milky discharge that comes in the first 2 days is very important. From the third day, once lactation, once the mother starts breastfeeding the child, more and more milk will start producing from breast, and the child will get the required amount. Now, the breast milk also will prevent certain diseases in the child. Most of them important is the respiratory diseases like pneumonia, asthma, and other infections of the respiratory tract. So the baby is saved from all these problems. And also, the baby will be protected from intestinal infections because you are giving sterile milk, which is very nutritious to the child. It will prevent any intestinal infections also. And in the long run, the baby will be protected from diabetes and any blood sugar impairment later on in life. It prevents obesity also in the child, so the baby does not put on excess weight also. So if you see, there are so many important points and important benefits to the child once he gets exclusive breastfeeding for the first 6 months. And it also creates an emotional bonding, that skin to skin contact while the child is feeding on the breast of the mother. That contact is very important. It brings out emotional bonding between the child. So psychologically, mentally also, for the child, it is very important because it brings security and a feeling of emotional bonding in the child. For the mother also, it is the same. And in the mother, the advantages will also include many, like she will be protected from so many problems which happens immediately after delivery. So after delivery, there may be excessive bleeding also. So what happens when the mother is feeding the child? There's some hormone which is released from the pituitary gland, which is present in the brain, and the oxytocin is released. So this oxytocin will act on the breast as well as on the uterus. So uterus is contracts well after delivery. So that will reduce excessive amount of bleeding after delivery or after cesarean section if the mother feeds her child. So it is important that the mother is put to the breast immediately after delivery to reduce the amount of bleeding. Also, it will prevent some amount of postpartum depression. They say many ladies, when after delivery, they go into some form of depression. They feel lonely and sometimes too much worked up because every time 24 hours they are busy with the child, so they can develop some depression. So it seen that it prevents that depression also. Then there are added benefits because in the long run it will prevent the incidence of breast carcinoma and also ovarian carcinoma. So these cancers can be prevented in the ovary and breast. So that is the two main benefits of breastfeeding. Also, for the mother, it will reduce the chances of diabetes. So, considering the advantages and disadvantages in the mother and the child, it is very important to breastfeed the baby. And that is why we promote breastfeeding exclusively, meaning only breastfeeding till 6 months after delivery. So now, when a mother feeds the child, it is very important to make sure that she's feeding in a proper manner. The technique should be proper. And in the first thing that I would like to say for the technique is that the baby should latch on the nipple and the areola. So the black part on the breast should be in the baby's mouth. So the whole areola, the black area and the nipple. Otherwise, there will be problem in feeding. The baby will not be satisfied. The baby will go hungry, and the mother will also develop some problems like sore nipples because of poor technique. And once the sore nipples occur, that means that is some irritation around the nipple and the areola. So the frequency of breast feed will go down, and the mother and the child both will get frustrated. So it is very important to maintain a proper technique of breastfeeding. So, one, I said that the baby should latch properly on the areola and the nipple on the hole, and the chin should be in contact with the mother's breast. And always, it is demand feeding in the initial days of life. So, once the baby is born, we do demand feeding. That means when the baby is hungry, there will be certain signs which will make you know that the baby is hungry. So, like rooting, the baby will start putting or sucking on the thumb. So, like baby will start crying and fidgeting, and he may even go red with crying. And so these are certain signs which will tell you that the baby is hungry and you have to feed. So, this is known as demand feeding, which is followed for the first few days of life, and after that, the baby once becomes after few days after later, they may take the feed every 2 hourly or 3 hourly. Now, it is also important that when you are feeding the baby, the breast milk should be fed from both sides. So give enough time, make the baby more comfortable. The mother should be comfortable. Sometimes some help may be needed because in ladies who are pregnant for the first time, they may not know the correct technique and the correct way, and they may have difficulty feeding the child. So sometimes help is also required, and in hospitals where the baby is delivered, the mother will get help from the staff, from the doctors and the nurses. So proper skilled counseling is given in the hospital where you deliver. And as I said, full sterility should be maintained before feeding. So the breast should be clean, and you can always clean it with washing, or you can use a cotton soaked with water, and the breast, especially around the areola and nipple, should be clean before you give the baby breast milk. And one side, once the breast milk has been expressed fully, then you can switch on to the other breast so that the child can get enough milk. So, and after the baby is breastfed, then you need to also burp the child. So you have to see, because that the child, when he's feeding on breast, may take in air. So then you have to put the baby on the shoulder, rub his back gently so that all the air which has been swallowed in should come out, because that is known as burping. And after that only the child should be put on the cot on the right side so that he may not aspirate, he or she may not aspirate while lying down. So burping also is very important after the baby has been breastfed. Now sometimes some questions may arise during breastfeeding, during lactation. You can always take help of the doctors and the nurses, especially while you are in the hospital. And nowadays, because of the COVID infection, because of the corona infection which is going around, one always gets some doubts whether the baby should be put on breast milk or not. So, according to the WHO guidelines, which is the World Health Organization, they say that women with COVID-19 also can breastfeed their mother, the baby, but you have to maintain all the precautions which have been prescribed by the WHO guidelines. So, what are those precautions? One is that you should practice hygiene, wear mask while breastfeeding the child. Also, wash your hands before and after touching the baby. And also, routinely clean and disinfect the surfaces. So, complete precautions in terms of hygiene should be maintained, like what you're maintaining generally, also otherwise, like wearing mask, keeping distance from other uh, family members, and also washing your hands more frequently before and after feeding the baby is very important. If the mother has COVID-19 and is very unwell, then also there is say that expressed breast milk can be given to the baby. So all this is very important, especially during this time of corona, and we need to practice total hygiene while feeding the baby. So I understand all pregnant ladies are here in this live chat, but these all practices need to be followed, especially regarding breast milk, lactation after delivery of the child. And since we are celebrating this week as breastfeeding, we are promoting this, and that is why I thought I should speak on breastfeeding on this particular day. So we can go on with the questions, Mr. Ravi.
Yes, madam. Thank you so much for speaking on such a wonderful topic. And as Dr. Kavita ji said, the breastfeeding week, Kavita ji has also been doing so many educational programs. You can see her back again on August 7th also, where we have so many doctors, including Dr. Kavita ji, speaking on this topic. So like Kavita ji said, breastfeeding is the best feeding. We'll start taking questions, doctor. The first question of the day from Sri Devi. She's 20th week of pregnancy. In her triple marker test, trisomy 18 is high risk factor. However, the anomaly scan is normal. Doctor advised her to take fetal karyotyping test further. How much is the chance that fetal karyotyping results will give low risk result? Doctor asked her to stay positive since the anomaly scan is normal, and the karyotyping is to rule out the trisomy 18.
So I would like to know the age of this patient and whether she had any problems in a previous pregnancy. Is this your first pregnancy?
Yeah. So Sridevi, if you're watching this live, can you let us know your age and the detail, any obstetric history you want to share? Yeah.
These are some factors which will tell us how much you are at risk. So if you can tell the age and whether it is your first
Yeah.
pregnancy.
Sure,
So,
doctor. So till Sridevi comes back, shall we take the next question, doctor?
yes, sure, sure.
Yeah. So Akanksha, hi, good evening, Akanksha. Her 21st week has started. She noticed a lot of food cravings at off times, like 4 a.m., 6 a.m. And she's having backache if she's standing or walking for an hour or two. And sometimes pressure on vagina, like something is heavy. Is it normal?
Normally, food cravings do occur during pregnancy, and you may have craving sometimes for sweets or for other things, because this is the time when you have finished your first 3 months, and the first 3 months, like, you must have had problems in taking the normal routine food that we have, because that is the time when you have excessive nausea, vomiting. So this is a time when you come back to your normal diet and you may have food cravings. It happens during pregnancy. And if you're having pain and heaviness in the lower abdomen, then I think you need to just go with a urine routine test to see if there are any urinary tract infections which may cause that heaviness. Otherwise, normally also it can happen. Just take more of rest. And if you're having crampy pain, then you need to take some other medications. And if you're having any associated bleeding or something, and take more of rest at home, that will be fine. And not to take do any strenuous work. You can do your daily routine, you can do the kitchen work and all that, but not to avoid strenuous work, so that lower abdominal heaviness should go off. If your urine routine is normal, then you need not worry. Take some rest also.
Thank you, doctor. Bhavani has a question. She's having umbilical hernia after the first baby, and it's been nearly 4 years. She didn't get the surgery done because she wanted another baby, and now currently she's in 14th week of pregnancy, and she's getting pain in the umbilical area for 15 days from last 2 months. Um, she can see her small intestine popping. She's saying. She
Okay.
push in as told by her naturotherapist, but she's scared of her third trimester. Will she get too much pain?
So, if you have an umbilical hernia which has been diagnosed, best is to show a surgeon, especially if you feel that your intestine is popping out, because that intestine which pops out is not a very good sign. Sometimes it gets strangulated and you may have severe pain, and that will be an acute emergency. So besides your gynecologist, you need to consult a surgeon. And if in case surgery is required, I think this is the best time to go about it, because it may land up with complications later on. Because if that is what you're telling me, that your intestine is coming out, so you need to show to a surgeon.
Thank you so much, Doctor. Sridevi came back with her age and history. She's 30 years old, and earlier she had a miscarriage at 6th week of pregnancy. Shall I repeat her question again,
Yes,
Doctor?
please. Yes, please.
Okay. Yeah. Her anomaly scan is normal, and the triple marker test trisomy 18 is high risk factor. So doctor asked her to stay positive and go for karyotyping, and wait for the result. So she's concerned about this.
Yeah, actually, we do not do triple marker nowadays. We go in for quadruple test. And if a anomaly scan is normal, but still if the trisomy has come as positive, then this is the correct time to get a correct diagnosis and get a karyotyping done. So at this time, she will have to undergo amniocentesis and karyotyping if she wants to be 100% sure that the baby is not having trisomy. She has no other risk factors as such. But then at this time of pregnancy, we normally do an anomaly scan and a quadruple test. But if she wants to be 100% sure about her trisomy, then she has to do amniocentesis with karyotyping. So this is the best time, because it will take time. Before 20 weeks, she needs to do it.
Thank you so much, Doctor. We wish you all the best, Sridevi. Next question from Rashmi. She's saying that TDAP is not available in her place. So the doctor suggested her to take a second shot of tetanus. Is it okay?
TDAP is usually available everywhere, but if you do not have that, then DT is fine, because second dose of DT will be required, though it will not give you protect the baby against pertussis. So, because TDAP has for tetanus, diphtheria, and pertussis, but if you've had got one shot of DT, then you can go ahead with DT again, second shot.
Thanks, Doctor. Swapnali's question. She's in 28th week of pregnancy. The fasting sugar is 135, and post 2 hours the glucose is post 2 hours 100 grams of glucose is 224. What all precautions she need to take now?
Now, since you are already 28 weeks and post-loading blood sugar, you said is 135.
Fasting
Right.
blood sugar is
Ravi?
135.
Fasting.
Fasting is 135, and post 2 hours 100 grams of glucose is 224.
That is very high. Actually, fasting is also very high. So you need to go on a diet, and we need to calculate your diet for a diabetes. Actually, we will label you as gestational diabetes mellitus, and you need to be on a diabetic diet. We need to calculate the calories according to your body mass index. And on diet, we need to do a fasting blood sugar and a postprandial blood sugar, and even start you on some medication. So that medication would be insulin, most probably, because it is fasting is very high, 135. We normally aim for 95 and less, and the 2 hours should also be less than 120 or 140 at least. So I think you'll have to consult an endocrinologist as well as your gynecologist and start this medication immediately along with diet. Because if you don't control it now, then there will be problems in the baby. Like the liquor will increase in amount, and the baby size also will be more according to the gestational age, and there may be other problems as well in the baby. So you need to consult and start on diet and medication immediately.
Thank you, Doctor. Next question we take from Aru. She's 36 years old and in 28th week of her twin pregnancy. Cervical cerclage is done in the 15th week. Her concern is as soon as she wake up in the morning, she get watery discharge. It's not sticky at all. Is it normal?
If it is completely watery and colorless, then it is a matter of concern. You need to get an examination done by your gynecologist, because after cervical circulage, then there can be a small risk of rupturing the membranes. So you need to consult a gynecologist so that she can examine you and see whether it is liquor. That liquor is the amount of fluid that you have around the baby. It should not be that. So if it is watery and coming frequently every day, you need to keep a pad, then it could be the liquor. She can also do an ultrasound to know the amount of liquor around the baby. So only visual inspection will let us know whether it is liquor or it is just a discharge, because normal discharge, what happens in pregnancy, is little thick and it can be little sticky, but colorless and fluid like is a matter of concern that you need to get yourself examined.
Thank you, madam. Next question we take from Lakshmi Priya. She's 33 weeks pregnant and she had the nose swelling from the last 3 weeks and there is no smell. Any suggestions?
I am 33 weeks pregnant and I had my nose swell from 3 weeks and no smell. Okay. So this no smell has just recently come up in Corona times. So because that is one of the symptoms of COVID infection. So you have to take little precautions and consult your medical doctor, a physician. Otherwise, the nose swelling, if it is not having any other issues like bleeding or anything else, then it is not a problem. But the nose smell is little suggestive. So please consult your physician, Lakshmi.
Thank you,
I
doctor.
hope you don't have fever or cough or body aches.
She's feeling pain in the left leg and the breast area.
Okay, this is from Shraddha.
Sorry, I mixed it up.
No.
No. It's from Shraddha. It's a different question. So sorry, Lakshmi. Lakshmi's question is over. Shraddha is feeling pain in the leg and the left leg and the breast.
So the left leg, if there is only pain, it may be just because of the pressure of the uterus, which may happen frequently during pregnancy. And the breast pain, if there is no swelling, no mass, if you don't see any redness or any inflammation, infection, then it should be fine. Because sometimes pregnancy, the breast pain may be there. And for your leg pain, you can just take some analgesic like a paracetamol if it is really severe. I hope you are taking your calcium and your supplementation in iron, and calcium should be taken.
Thank you, doctor. Aparajita's question: in 36th week of pregnancy, when can she expect milk formation, and also how to increase the breast milk?
Aparajita, actually, the breast milk starts forming after 3 months of pregnancy, as early as 12 weeks of pregnancy. So if you press the breast, you will see that breast milk will be there. Though I don't suggest you that you should not press and see it now, but it starts as early as 12 weeks of pregnancy. And right now, you need to just keep your diet good, eat more of protein, and just check whether your nipples are in good and everted, because after delivery you should not have problems in feeding the child. If the nipples are inverted or flat, then we advise after 36 weeks to have some nipple exercises so as to make them everted. So after delivery you should not have problem feeding the child.
Thank you, doctor. Nivya is asking, having 2,400 grams weight of baby at 34th week, is it normal?
How much is the weight?
2.4 kgs.
Sorry, I didn't get you.
2,400 grams.
That is fine. Around 24 weeks, 34 weeks, it is fine, absolutely.
Shruti has a question, doctor. She's 14 weeks pregnant. Which cough syrup can she take for cough? Is cherry cough safe?
Yes, it is safe. You can take Benadryl also or cherry cough, but make sure that you have no other symptoms like fever or sore throat, for which you need to have some added investigations and added medicines also. So only if it is cough, then you can take a cough syrup like cherry cough and Benadryl, which I just suggested, and take steam inhalation also, so that it helps. So the
Thank you,
next
doctor.
question is, I have pain in my left side, upper side of my leg. Due to this, I am facing problem in lying on bed and during walking. What should I do for this pain? So, are you in the third trimester, like after 32 weeks of pregnancy? Then there may be slight problem while lying on bed and turning, because all the weight of the baby is there. So, and the joints become lax and the ligaments also become loose. So you may have difficulty in getting up, lying on the bed, taking sides, and while walking also. So if you have pain, you can take some analgesic like paracetamol. Otherwise, this will become you will get relieved of this pain after delivery.
Thank you, doctor. Next question by Manashri. 28th week of pregnancy, sometimes there is water discharge from the breast. Not very occasional, what to do?
If it is a clear watery discharge from the breast, you need not worry, because as I said earlier also, the breast milk starts forming as early as 12 weeks of pregnancy. So if it is not blood stain, no other color, then you need not worry. And you need not press it out and see, because that it will be there. So the next question is from Sonal Priya. I am 6 weeks, 2 days pregnant. What food should I eat and avoid? So at this gestation, early in pregnancy, usually patients will have problems because of the nausea and vomiting, which is known as morning sickness. Whatever you feel like eating, you should eat. Not force yourself to eat anything particularly. Like many times, the family members may force you for milk or curd. So whatever you feel like eating, you can have. If you want normal diet with proteins, that will be good, and you need not force yourself for anything particularly. And the food that you should avoid, every food you can take, but in moderation. If you have anything in excess, then it is a problem. Anything in moderation you can take. Also, sometimes I'm getting white vaginal discharge. Is it safe? If it is a white vaginal discharge, it is normal during pregnancy to have some vaginal discharge. It is quite normal. Until unless it is foul smelling or itchy, then you need to consult. So the next question is from Shivani. In my first pregnancy, I could not breastfeed due to lack of milk. Now I'm 27 weeks pregnant. Do I need to take any precaution for the production of breast milk? So, as I said earlier, also, you need to check whether your nipples are not having any problems like inversion or flat. If they are everted, and nipple exercises are advised, so that there is no problem during feeding after the delivery. And also, well, during after delivery, you can have good proteinaceous diet, and the more you breastfeed the baby, the more oxytocin is released and more milk will be produced. So do not give up after delivery to breastfeed your child, especially demand feeding in the early days, and then every 2 to 3 hours whenever the child requires. So you have to breastfeed and keep it going, so that more milk is produced. I'm sure there won't be problems much this time. So the next question is from Deepthi. I'm 34 weeks of pregnancy. It's my second delivery. I lost my first baby during delivery at full term 1.5 years ago. Can I deliver at 36 weeks? Will the baby need NICU? I have healthy pregnancy. So if you're having healthy pregnancy, there are no antenatal complications as of now, then it's better to go on with the pregnancy. Keep a track of the daily fetal movements of the baby, and you can go up to 38 39 weeks of gestation also, but with good monitoring. That means you should be in consultation with your obstetrician, and not necessary the baby will have NICU admission. 36 weeks is preterm, so I will advise that you go up to at least 38 39 weeks of gestation if there are no other problems.
Thank you so much, doctor. We'll take one question inside the iMumz app. Chandana Bhimesh, she is 31 weeks pregnant and she tested COVID positive. She's asking for your advice.
Okay, so for COVID positive, then you will have to be under a supervision of a physician and all the precautions, because you will have to be isolated from other members. Otherwise, if you are having any symptoms, then need to consult the physician. Otherwise, a normal routine you have to follow: be quarantined, take your precautions of personal hygiene, and I think they will do a COVID test repeat again. So if that comes negative, then you can carry on. And this time of pregnancy, if there are no other problems, then you need not worry for the baby as of now.
Thank you, Doctor. Mukesh Gupta's wife, she had gone to DNC, and when can they plan baby again? In the 12 weeks, they had a missed abortion.
Omphalocele also shown. I asked this is again happen in my future pregnancy. So because the baby had some anomaly, uh, and you had a missed abortion at 12 weeks, you need to get some tests done before you plan the next pregnancy. So, and you need to be on folic acid also. So start taking folic acid and get some investigations done. Like a blood sugar is very important, because if the blood sugars are impaired, there are high chances of developing anomalies in the first trimester, that is at around first 3 months of pregnancy. And you can plan your pregnancy if not before 6 months. You should take a gap of at least 4 to 6 months. So the next question is from Reshma. I am too suffering from upper abdominal pain, that too at night, too much also suffering from constipation. And I took 3 doctors' opinion, all are saying it's gastric. Yes, it can be gastric, Reshma, but then the constipation is because of the increased progesterone levels that one has during pregnancy. It decreases the gut motility also. So for constipation, you need to take lot of fluids, take lot of water, at least 2 to 3 liters of water every day. Take high fiber diet, like you can take some salads and you can take apple, cucumber. High fiber diet will keep your stool soft, and drink lot of water. If you're not relieved, then we give a mild laxative also. You can take in the night 2 tablespoons. And the upper abdominal pain can be because of acidity, and you need to take some antacid. You can say take some antacid tablets, or the syrup like Digene or Gelucil tablets. And also when you're lying down, just make sure that your head is little higher, so you can keep 2 pillows, because there can be reflux esophagitis during pregnancy. The next question from Priyanka. After a cesarean section, how long does mother stay on antibiotic? What impact does cesarean section have on breastfeeding? So is there any problem in having milk? Do these antibiotics have negative effect on baby? So the cesarean section, normally we don't advise. We just give a prophylactic dose, 1 dose of antibiotic. But if you have any other added signs of infection, then the obstetrician may give antibiotics for a longer period. Otherwise, we just give at least 1 dose. Some doctors may prefer to give for 3 doses, one before and 2 doses after cesarean section, depending upon the situation, the reason why cesarean section was done. If there is any infection, or sometimes if there is wound infection, they may give it for a longer time. And cesarean section as such will not have any problems during breastfeeding. You may take a little more time, because after normal delivery, one does not have so much pain. Because cesarean section, there will be an abdominal wound, so you may take some time, especially after anesthesia, to recover. So, but you can put your baby on breastfeed immediately as soon as you feel well, and there are no problems in having milk. And the more you put your baby to the breast, the more the milk will come, because oxytocin will be released. And the antibiotics as such do not have any negative impact, because obstetricians will give those antibiotics which are recommended during pregnancy and after delivery. So don't worry for that.
Thank you so much, doctor. The next question we take from Chaitra. She couldn't feel the first baby due to the lack of milk. Now pregnant with second due in December. Please advise how can she ensure that she can feed the second one.
So again, as I said earlier, that you have to make sure that there are no breast or nipple concerns which need to be addressed before delivery. So your obstetrician needs to check the breast, whether the nipples are in everted and there are no issues in that. And as I said, immediately after delivery, you should put the baby to breast so that the breast milk comes, and whatever colostrum comes in the first 2 days also you should feed. And the more you feed on demand of the baby, the more milk will be produced. Keep your diet good and proteinaceous, and it should not affect the breast milk production. The next question is from Shilpa. How to know if the baby is getting sufficient breast milk? I had undergone cesarean. Milk started from fourth day, slowly reduced formula milk. Baby is 2.5 weeks. I am giving formula milk at least once a day. So I hope you consulted your pediatrician, Shilpa, and how to know if the baby is getting sufficient breast milk is because you will come to know whether the baby is satisfied and the baby stops crying, has a good sleep after you give the breast milk. So normally at this point they start taking every 2 hourly, 3 hourly if they are well satisfied. And keep your diet good and drinks a lot of water and fluids because 70% of the breast milk is having water. So if you do not take enough water, then that also affects breast milk production. And give demand feeding as well as when the baby grows up, then every 2 to 3 hourly. For formula milk, I don't know whether your pediatrician has advised, but you should consult them before you put them on formula milk. So the next question is from Kirtana. I am now 20 weeks pregnant and 16th week. My doctor told me my placenta was lying down. Next week I have doctor appointment. No, my placenta is okay. I'm not worried. So at 20 weeks of gestation, the placenta may be low. Sometimes on ultrasound, you can see that the placenta is in the lower uterine segment. That is what we say as low lying. But you have to be just little precautious. Do not do any strenuous exercise or strenuous work, and avoid sexual intercourse. And mostly these placentas they migrate. So as you pregnancy advances, many of these placentas they go up into the upper uterine segment. So you should not have problem. Whenever the next ultrasound is done, they will again check whether the placenta is lying low or it has migrated to the upper uterine segment. So as long as you're not having bleeding, you should not worry so much. So the next question is, I am 30th week pregnant. I have fibroid. Is it dangerous because it is big, 18 centimeter? Any medicine for it? So Devi, you need not take any medicine right now. What happens during pregnancy is the fibroids usually grow, especially during the second and third trimester because of the effect of pregnancy hormones. And it may give some problems, like sometimes there can be preterm labor, preterm delivery. It may cause problems in the baby's growth, fetal growth restriction, and also during delivery. So we need to check where the fibroid is, and your obstetrician will then counsel you whether you can go ahead with the vaginal delivery or cesarean section. Shanti writes, I am in 33rd week. I am not gaining weight since 2 months, but the baby weight is 1.9 kg. Is it normal if I don't gain weight? No, Shanti, it is not normal that you're not gaining weight, but I hope you're taking a good diet and take some more of protein diet, and you can ask your obstetrician, whoever is the consultant, because we should not stop gaining weight. The ideal weight gain during pregnancy is around 9 to 11 kg. So I do not know from where you started, but 9 to 11 kg is the ideal weight gain. And keep your weight record on a particular machine, because sometimes there can be errors in the machine as well. And keep a track of the movements of the baby as well. And ask your obstetrician whenever you go for an ultrasound to check for the Dopplers, because the Dopplers and the umbilical artery will also help in telling us if there is any problems in the supply of blood to the baby in utero. So that also helps and guides us when to take the patient for delivery. And there are other things to be monitored as well, as the amount of how your movements are. Take enough rest also, and whenever you lie down, you should lie down in the left lateral position, because that helps in giving more blood supply to the baby. There is no uteroplacental insufficiency, we say, more blood and nutrition to the baby. Then there's next question is from Umama Afroon, and she writes, I am in 18th week of pregnancy. I had mild shock on the little finger while plugging up the charger. I am very worried about my baby. Please clear me. Does it affect my baby? I am okay right now. I am fine right now. So if it is a mild one, it should not really affect, but I think you should go and consult your obstetrician and get the fetal heart checked for the baby. It should not create much problem. And because 18 to 20 weeks, I am not very sure whether you can feel the fetal movements right now, because it's a little early in pregnancy. So if you can just get the fetal heart checked, it should be fine. Ravi, can we have the next question?
Yes, doctor. So Bhagyashri, I can't locate your question. Can you post it again? We don't have your question. So next question we take from Messi. Her nose is blocked due to the cold and weather changes. No fever, no sore throat. Oxygen level is okay. Her nose is blocked and having issues in getting smell taste of food, and she's taking steam. So what precautions can she take more?
Yeah, steam is a very good thing to take during these symptoms when your nose is blocked. And as you say, it is because of the cold and weather change. So the steam will help, and it will at least take twice or thrice a day. But if you are having issues like you cannot taste the food and there's no smell, then obviously you'll have to consult a physician. If it is because of the blocked nose, if it is so severely blocked, then steam will help. I hope you're not having fever and cough.
Thank you, doctor. Shalini has a question in her 33rd week of pregnancy. How to overcome low BP? Her blood pressure levels are 105 by 65. Any diet changes or any thing she can incorporate?
What is the period of gestation you said?
33 weeks.
How many
33,
weeks?
33 weeks pregnancy, doctor.
Okay. So as such, we do not advise any medication for the blood pressure if it is low, but I would advise you to take enough of water. So maintain hydration, drink lot of water, 2 to 3 liters of water at least every day, because if you are dehydrated, then also your blood pressure can get affected and you may feel weak and little dizzy also. Usually it happens during pregnancy, but it happens in the mid trimester. So around 20 weeks of gestation, the blood pressure goes down. But whenever it happens, you need to take a lot of fluids. As such, we do not prescribe medications.
Thank you, doctor. Sridevi, who earlier talked about trisomy 18 risk, she got her quadruple test and the risk is low. Again, should she go for amnios and karyotype test? She's asking.
No, but earlier you said the risk was there, and hello, Ravi.
Yeah, can you hear, doctor? She said her quadruple test results are out now. She just got them, and the risk of trisomy 18 is low. She still need to go further for immunocentis further?
See, at 18 weeks, if you have done a scan and it has included the genetic sonogram, because there are soft markers for trisomy at this point of time. So you will have to get a genetic sonogram where they see all the markers for Down syndrome and trisomy 18 and 13 also. And if it is accurate, then you can avoid amniocentesis. But Again, if you want to be 100% sure whether the baby is not having trisomy, then because there are multiple factors which we see when advising. So the risk may be there, but if you want to be 100% sure, then amniocentesis with karyotyping. But then if you do not want that, then a genetic sonogram by a fetal medicine specialist.
Swarna's question, doctor. Her baby is weighing 388 grams in the 6 month of pregnancy. Is there any issue? She is asking.
See, this 388 grams is obviously less for a 6 months pregnancy, and we need to do an ultrasound to see if there are any problems in the baby, like congenital anomalies, or if there are any again markers for chromosomal anomalies. So 388 grams is definitely less at this point.
Thank you so much, doctor. Next question we take from Pooja. Pooja is in 11th week of pregnancy. Till 10th week, she faced little spotting and common pregnancy symptoms. Now she is not facing anything. Is it okay if she is not facing any symptoms? She is asking.
I hope your bleeding has stopped now. If that has not there, then you have to just see whether the ultrasound which was done, whether it shows the fetal heart rate. Because right now, only ultrasound will tell us whether the fetus is doing well. So you need to check on ultrasound whether the fetal heart rate is there, and that's it. Because this bleeding may occur again during pregnancy, and I hope you are having all the symptoms and signs of pregnancy. It is not regressed: nausea, vomiting, breast tenderness. If it is there, then most probably the baby is viable and the fetal heart rate is there. But please go in for an ultrasound to check for the fetal heart rate.
Yeah, a small announcement here. Okay. So from this Monday to the next Monday, we're running an offer on the baby care program. It's 20% off. You can just avail all the benefits of baby care program by using this. Next question we take from Drashti. She's in 34th week of pregnancy and 2.15 kg is the weight for the baby. Is it normal?
Yes, it is within the normal limits.
Thank you, doctor.
Hello.
Yeah. Thank you so much, doctor. Aishwarya's question. She's 32 weeks pregnant. She's getting vaginal discharge often nowadays. Please advise.
If it is a thick white discharge, Aishwarya, without any foul smell, not blood stain, then you need not worry because it happens during pregnancy. But in case if there's some smell or if it is itchy or if it is very watery, then you need to consult. Otherwise, usually it can happen during pregnancy.
Thank you so much, Doctor. Swarna, doctor has answered your question. So please check what doctor has answered. She has given you a great advice. So please follow, and we wish you all the best. And so sorry we can't take any more questions for the day.
Okay, is this the last question?
Yes, doctor. We take one last question of the day inside the iMumz app. So it's been last 1 hour has been so great. Many people have been thanking you for answering all the questions so wonderfully. You can see Shilpa,
Right
everyone thanking you. Yeah.
now, those who have logged in and those who asked me questions, and I hope I answered you. And there may be still doubts because there are a few things which you need to see while you are talking to patients on this app. But there are things which are cleared when we examine the patient, particularly like how the vaginal discharge is, how much is the growth abdominally, and whether ultrasound was done. But I hope I've answered some of your doubts. Thank you so much.
Absolutely, madam. People are thanking you so much for taking your time and answering many questions positively. Would you like to share one final message from your side to all the to be mothers out there?
Yeah, right now the only message what comes into my mind is that we need to follow all precautions, especially antenatally, all pregnant ladies, keep your diet good and take all the precautions so as to avoid the infections and personal hygiene and hand washing and mask and social distancing. So need to maintain that, especially in this difficult time. And I wish my best wishes and good luck to all of you so that you have a smooth pregnancy and a smooth delivery. Thank you.
Thank you so much, Doctor. One last question can we take, Doctor? Someone is requesting.
Yes, sure.
Yeah.
Yes, sure.
Yeah. Thank you, Doctor. Sushri is requesting. She is in 4.5 months of pregnancy, and from yesterday, she's feeling severe pain in the back and the hip area. How to get rid of that pain?
Okay, so it is in the back and hip area. So if it is very severe, as I said, you can take some analgesic like paracetamol, you can take, give some hot water fermentation to that area. And you can apply some gel also. And but if it is very severe, not relieved, then you need to show to an orthopedician. If it is very severe that you cannot sit down, so it could be because of some orthopedic problem, because you're writing it is very severe and not able to sit down. But for the general measures, I would say that you can take some paracetamol and some hot fermentation with hot water bottle so that it gets some relief.
Thank you so much, everyone, for joining. We wish you all the best. Stay safe, stay healthy, stay happy. And a very, very special thanks to Dr. Kavita ji for taking her time. We are very, very lucky to have such a senior doctor today with us. Thank you so much, madam, for answering all the questions and joining iMumz for this Ask Me Anything session.
Yeah. And one last message, stay positive. Okay, thank you so much, Ravi. And I
Yeah,
really enjoyed your session.
yeah.
And we'll look forward to some more sessions with my
Sure,
patient.
madam. It's
Thank you
it's
so
our
much.
pleasure to have you again and again, madam. Thank you so much. Have a great day, everyone.
Okay.